Have you ever taken a gout pill and a few hours later felt your stomach churning, got nauseous, or even developed a stubborn headache that wouldn't go away? If so, you're not alone. Millions of adults in the United States live with gout, and most rely on medication to ease pain and control flare-ups. What we don't hear enough about is an important truth. Along with benefits, those pills can carry quiet side effects that affect your overall health, and that's exactly what we're going to dig into together today. Hello everyone, this is JointWise Health, the place where we walk alongside middle-aged and older adults in the U.S. to tackle gout and joint issues, and where we support family caregivers looking after parents and grandparents. If you find this content helpful, please give us a like and subscribe. That small action helps us keep creating practical videos that improve quality of life in our community. Today, we're going to speak plainly about side effects of gout medications. This isn't about scaring anyone. It's about giving you trustworthy, science-based information. When you understand what's going on, you can make smarter choices, combining medicines with diet and lifestyle to protect your long-term health. Sometimes it's the overlooked side effects that quietly make the condition worse. Picture this. A 58-year-old man named Michael in Florida starts taking allopurinol, the most commonly prescribed uric acid-lowering drug. After a few weeks, he notices an itchy, red rash. At first, he assumes it's a minor allergy, but it gets worse. Without timely attention, that could become serious. Michael's story shows that medication can rescue us from joint pain, but it can also create new problems if we're not paying attention. Here's the first key point. Gout medicines are not vitamins, and every body reacts differently. That means whatever your doctor prescribes should always be paired with careful self-monitoring. No drug is absolutely safe if we use it the wrong way or ignore warning signs. One class of drugs that commonly causes side effects is the uric acid-lowering group, particularly allopurinol and febuxostat. These medicines help prevent gout attacks by reducing the body's production of uric acid. That makes perfect sense, but the human body is complex. When the liver's enzymes have to process a drug for a long time, the risk of hepatitis or liver injury can appear. Common signs include fatigue and yellowing of the skin or eyes. This isn't rare, and unfortunately many people chalk it up to just getting older or not sleeping well. Your kidneys are also affected. They already work hard to clear uric acid, and now they have to process more medication too. That's why anyone with a history of kidney problems or high blood pressure needs periodic checkups while taking uric acid-lowering drugs. It's also worth noting that a diet rich in vegetables, with limited salt and adequate water, can support your kidneys and lighten the load. Nutrition and treatment go hand in hand. Some people will experience skin reactions as well. Drug allergies can range from mild rashes and itching to severe reactions like Stevens-Johnson syndrome, rare but life-threatening. Older adults are especially likely to miss these warning signs because they're often taking multiple medications at once: blood pressure pills, diabetes meds, cholesterol drugs. When something unusual shows up, it's crucial to tell your doctor right away instead of stopping or switching medicines on your own based on a friend's advice. There's another side that isn't talked about much: mental and emotional effects. Some people on febuxostat report feeling anxious, having trouble sleeping, or experiencing mood swings. These reactions are uncommon, but they remind us that medications can affect the brain, not just the body. For anyone already worried about their health, that added stress can lower quality of life. So stay in close contact with your doctor and loved ones. Don't hide what you're feeling or tough it out alone. So here's the second key point. Gout medications don't just affect your joints. They're closely connected to liver and kidney health and even your mental well-being. Every side effect has signals, and our job is to listen to the body instead of brushing those signals aside. The good news is that not everyone has serious side effects. Plenty of people take these drugs for years without problems. But that doesn't mean we should be complacent. Think of it like driving. Some people go their whole lives without an accident, but everyone still needs a seatbelt. With gout meds, your seatbelt is routine health checks, listening to your body, and supporting treatment with a sensible diet so you don't have to rely on pills as much. Once we recognize all of this, a big question naturally comes up. If the medicine relieves pain but might harm the liver or kidneys, where's the right balance? That's the core issue we'll continue exploring next. When we've talked about the quiet effects on the liver, kidneys, and mood, you might be wondering, are there gout drugs that cause more obvious discomfort? The answer is yes. In fact, there are medicines that almost every patient experiences side effects from at least once, and sometimes those effects show up fast. A prime example is colchicine, the go-to prescription many doctors use to stop an acute flare. Anyone who's endured a brutal gout attack understands why colchicine is seen as a lifesaver. It can calm inflammation within hours. But along with that relief, colchicine is notorious for gastrointestinal side effects. Nausea, diarrhea, and stomach pain are very common complaints. Imagine a 65-year-old woman named Margaret. Each time her gout flares, she takes colchicine as directed. The joint pain eases, but within hours she's running back and forth to the bathroom. She ends up exhausted, can't sleep, and even loses weight because the diarrhea drags on. For older adults, who are more sensitive, dehydration can be more dangerous than the original gout pain. That leads to the third key point. Even small side effects can become big risks when you add age, other medical conditions, and overall health into the equation. A younger person with diarrhea might bounce back quickly. In seniors, dehydration can disrupt blood pressure and strain the kidneys and heart. So if you're taking colchicine, stay hydrated, eat gently, and call your doctor if diarrhea lasts more than 2 days. Colchicine can also cause muscle pain and weakness, especially with long-term use or when combined with other drugs. That's a big deal for older adults because muscle mass naturally declines with age. Weaker muscles don't just make walking harder, they raise the risk of falls and fractures, one of the most dangerous events after age 60. In other words, colchicine can stop a flare but open the door to falls if it isn't carefully managed. Next up are nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, naproxen, and indomethacin. Middle-aged Americans know these well, not just for gout, but for back pain, arthritis, and headaches. Behind the convenience, though, NSAIDs have a second face that doctors constantly warn about. Here's the fourth key point. NSAIDs can cause stomach ulcers and gastrointestinal bleeding. In older adults, the stomach lining is thinner, and anti-inflammatories make bleeding more likely. Many people end up in the hospital after vomiting blood or passing black stools because they took NSAIDs for weeks on end. A 72-year-old gentleman in Texas once told me he took just a few ibuprofen for joint pain. After a couple of weeks, he felt burning stomach pain and lost his appetite. Testing showed a severe ulcer. The lesson is clear. Even over-the-counter drugs can be too much for a body that doesn't tolerate them the way it used to. Beyond the stomach, NSAIDs can affect the heart. Long-term use has been linked to higher blood pressure, heart failure, and even heart attacks. That's a serious concern for anyone with existing heart disease or those managing cholesterol. In your 60s and 70s, each anti-inflammatory pill might calm a joint while quietly adding strain to your heart. If you must use them, doctors usually advise the lowest effective dose for the shortest possible time. Sometimes doctors prescribe corticosteroids such as prednisone to tackle severe flares, or when someone can't tolerate NSAIDs or colchicine. Steroids are powerful anti-inflammatories, but they come with a long list of side effects everyone should know. Within just a few weeks of prednisone, many people report rapid weight gain. a rounder face, and constant cravings. For older adults managing diabetes or high blood pressure, that's a ticking time bomb. Steroids also thin bones, which is the last thing you want if you already have osteoporosis or a fracture risk. And here's the surprise for many. Steroids can affect mood, causing anxiety, irritability, and even depression. Picture a calm, even-tempered 70-year-old who, after months on prednisone, becomes unusually irritable, can't sleep, and feels restless all the time. Family might chalk that up to old age, but it's actually a medication side effect. If it isn't recognized, it can strain relationships and leave the person feeling misunderstood and alone. So, colchicine, NSAIDs, and corticosteroids share a theme. They work quickly, but the risks can be significant if you use them improperly or without close monitoring. How do we minimize these downsides in everyday life? Start with a simple rule. The least, but enough. In other words, use the lowest dose that works for the shortest time, instead of overusing. Second, take meds with food, especially NSAIDs and colchicine, to cushion your stomach. Third, drink plenty of water, eat fiber-rich foods, and limit alcohol and high-purine foods to ease the body's metabolic burden. Another crucial tip: never mix and match medications on your own. Older adults in the U.S. often take multiple drugs for blood pressure, diabetes, and cholesterol. Add gout meds on top, and the risk of interactions rises. Some blood pressure meds combined with colchicine, for instance, can raise the risk of muscle injury. Always bring a current medication list to appointments and be upfront with your doctor. Side effects from gout drugs aren't exotic or rare. Precisely because they're familiar, many people underestimate them. The smart move is to accept that medication is only one piece of the management plan. With nutrition, activity, rest, and a positive mindset, you can lean less on pills and lower your side effect risk at the same time. Having looked squarely at those downsides, a bigger question emerges. If every option has risks, what's the safest, most sustainable long-term plan for middle-aged and older adults? That's what we'll dive into next. After hearing about the potential side effects of allopurinol, colchicine, NSAIDs, and corticosteroids, many of you might be worried. If every drug has risks, how am I supposed to live? Should I stop taking them altogether? It's a completely natural question. The clear answer is, medications are still necessary. The key is to use them wisely, strategically, and always in partnership with your doctor. Think of gout management as a long road trip. Medicine is the car that gets you there, but arriving safely requires a careful driver, clear road signs, and regular pit stops to check the engine. Long-term strategy works the same way. Here's the sixth key point. Routine monitoring is the key to controlling side effects. When you start allopurinol or febuxostat, doctors often recommend blood tests after 2 to 4 weeks and then every few months. These tests don't just check uric acid, they also look at liver and kidney function. Many patients feel fine, yet their labs show early liver stress. Catching that early lets the doctor adjust the dose or switch medications before serious trouble develops. Consider Thomas, 63, in California. He took allopurinol for 5 years without issues. At a routine appointment, his liver enzymes were unexpectedly high. Without that visit, liver damage could have crept forward. After changing meds and tweaking his diet, his liver normalized. Feeling nothing doesn't always mean nothing is happening. Seventh, loved ones play a vital role in spotting clues. In many American families, a spouse or adult children are the first to notice changes. More irritability, fatigue, poor appetite, restless sleep. Those small shifts can be early signs of side effects. If you live alone, keep a simple health journal. What time you took your meds, how you felt, any nausea or stomach pain. A few lines a day can give your doctor the data needed to fine-tune your plan. 8th, personalize the strategy. No two patients are identical. A healthy 50-year-old might tolerate short stints of NSAIDs, while a 75-year-old with heart disease and a sensitive stomach faces higher risks. Doctors adjust treatment based on age, conditions, and habits. That only works if you're honest. I take daily aspirin, or I like a glass of wine at night. If you hide information, your doctor can't build the safest plan. 9th, lifestyle changes reduce reliance on meds. Maintain a healthy weight, drink enough water, and limit alcohol and high purine foods so your body naturally produces less uric acid. Fewer flares mean less need for colchicine or NSAIDs, which means fewer side effects. A 68-year-old in Oregon told me, "I've needed less medicine since I started walking 20 minutes a day and eating more vegetables." She didn't believe small changes could matter, until 6 months later, flares were rarer and her doctor lowered her dose. Lifestyle isn't optional. It's part of the treatment. 10th, keep communication open. A common mistake is stopping medicine abruptly when a side effect shows up. That can spike uric acid and trigger a worse flare. It's better to say, "Doctor, my stomach gets upset after colchicine. Is there another option?" Often there is. Adjust the dose, switch drugs, or add stomach protection. Suffering in silence or quitting cold turkey usually backfires. In the U.S. system, you may see multiple clinicians, primary care, rheumatology, cardiology. Each might prescribe something different. That's why carrying an updated medication list to every visit is essential. It helps prevent dangerous interactions between gout meds and treatments for other conditions. 11th, community support matters. Gout is chronic, and side effects affect mental health too. Many people feel like they're fighting alone. Local or online groups can change that. Hearing how someone handles colchicine stomach upset by taking it with yogurt, or how they set reminders with their grandkids, can be the nudge you need to keep going. Here's the bottom line. Managing gout isn't just about pills. It's a collaboration among you, your family, your doctors, and your community. With everyone involved, side effects get spotted early, handled promptly, and you can maintain quality of life for the long haul. Remember, most side effects are manageable if they're recognized and addressed in time. A proactive, patient mindset can turn medication from a double-edged sword into a safe, helpful tool. Once you appreciate the role of monitoring, family, lifestyle, and communication, the final question is, how do I pull this together into a clear action plan that controls gout and protects my overall health for years to come? That's the focus of our last part of the conversation. We've come a long way in understanding gout medications and the side effects they can bring. From silent liver and kidney issues to more obvious symptoms like stomach pain, diarrhea, or mood changes, every side effect reminds us that medication is necessary, but never the whole story. So how do you live well with gout, use meds safely, and still keep a good quality of life? This is where an action plan comes in. 12th, build a personal tracking habit. Older adults often juggle many prescriptions, and it's easy to get mixed up. A weekly pill organizer or phone reminders can keep dosing on track. More importantly, jot down how your body reacts. A small notebook or simple notes app becomes a valuable health journal. When your doctor asks, "How have you been feeling?" you can point to specifics. 3 days ago, I felt nauseous after colchicine. That can guide more precise adjustments than lab tests alone. 13th, make routine checkups part of your lifestyle. Many people only see the doctor when something hurts. With a chronic condition like gout, that's like waiting for the car to break down before getting it serviced. Treat blood work, liver and kidney checks, and blood pressure readings as regular maintenance. Early detection prevents big problems. For Americans over 60, an annual or twice-a-year check isn't a luxury. It's an investment in longevity and peace of mind. 14th, strengthen your anti-gout lifestyle. This isn't an overnight overhaul, it's small, sustainable steps. A meal with less red meat and more vegetables. A glass of water instead of beer at night. A stroll around the park instead of hours on the couch. Repeated daily. These simple choices lower uric acid naturally. Fewer flares, fewer meds, fewer side effects. It's a positive cycle. 15th, learn to listen to your body. Older adults sometimes accept fatigue, insomnia, or indigestion as just aging. In reality, many symptoms are medication-related. Your body is always signaling. When something feels off, don't ignore it. Ask questions, look for causes, and talk to your doctor. A bit of initiative can prevent major setbacks. 16th, share and connect. Facing gout and medication side effects can feel isolating. Sharing experiences with family, friends, or a support group can ease the emotional load. Don't hesitate to say, "This medicine makes me anxious," or "My stomach's been upset." Often, simply being heard gives you the energy to keep going. 17th, and finally, stay positive and proactive. Gout is chronic, yes, but it's not the end of the story. Plenty of people in their 70s and 80s travel, do yoga, garden, and enjoy life, even while taking gout meds. The difference is that they manage the condition instead of letting it manage them. When you know the side effects, have a monitoring plan, and keep up healthy habits, your medication stops being a worry and becomes a partner. If this makes you a bit anxious, remember, no one expects you to change everything in a day. Start small, an extra glass of water in the morning, or a couple of lines in your health journal after you take your meds. Small steps, repeated, lead to big change. Before we wrap up, here's the take-home message. Small changes can make a big difference. Each time you choose a healthier meal, schedule a checkup, or talk openly with loved ones about side effects, you're taking a step toward a healthier, more comfortable life. If you found this video helpful, please like and subscribe to JointWise Health. That way, you won't miss new episodes, and you'll help spread this knowledge to others on the same journey. And if you have stories or tips about dealing with gout med side effects, share them in the comments. We'd love to learn from you. Remember, gout may be a challenge, but it doesn't define you. With the right knowledge, steady patience, and small daily tweaks, you can keep enjoying midlife and your later years, with joy, confidence, and good health. Wishing you a life that's active and well at every age.